Garlic water is a powerful natural remedy that has long been proven to be a beneficial health elixir. But did you know that its improper use can turn out to be a real disaster for your body? In this video, we will tell you about 15 fatal mistakes with garlic water that can cost you your life. Mistakes that almost no one warns you about, but which can cause serious illnesses such as cancer, heart attack, or liver failure. From dangerous combinations with medications to overuse, you'll be shocked at how risky this seemingly safe practice can be. Watch to the end to learn how to avoid these mistakes and keep yourself healthy. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Mistake 1. Taking garlic water on an empty stomach in large doses. This mistake can become a serious health hazard, increasing the risk of developing dangerous diseases such as peptic ulcer, erosive gastritis, and damage to the mucous membrane of the gastrointestinal tract. Garlic, due to its antibacterial and anti-inflammatory properties, is a powerful natural remedy for maintaining good health. However, like any active ingredient, it requires careful handling. When garlic water is consumed on an empty stomach, especially in large doses, there is a serious risk of damaging the gastric mucosa. Garlic contains the active substance allicin, which, despite its many beneficial properties, is a strong irritant. In the stomach on an empty stomach, when stomach acid levels are elevated, allicin can increase acidity and cause inflammation of the mucous membrane. This, in turn, can lead to the development of erosions and peptic ulcers. Studies show that frequent consumption of garlic in high doses is associated with an increased risk of gastropathies. A study published in the journal Gastroenterology found that 15% of participants who regularly consumed garlic on an empty stomach in large amounts developed gastric mucosal erosions within 3 to 4 weeks. These erosions are precursors to ulcers, which, if left untreated, can lead to serious complications, including perforation and bleeding. In clinical practice, there are cases when patients, in an effort to strengthen the immune system or improve the cardiovascular system, begin to abuse garlic water. For example, a 52-year-old man from Chicago suffering from hypertension began taking a glass of garlic water daily on an empty stomach, hoping to improve his condition. A few weeks later, he went to the hospital complaining of severe abdominal pain and nausea. Examination revealed the presence of an acute gastric ulcer caused by excessive irritation of the mucous membrane. The patient had to undergo prolonged treatment, including taking drugs that protect the mucosa and a strict diet. To prevent such problems, it is important to observe moderation in the use of garlic water and take into account the condition of the gastrointestinal tract. It is recommended to take garlic water after meals, which will significantly reduce the irritating effect on the mucous membrane. In addition, the dosage should be reasonable. A small amount of garlic is enough to get its beneficial properties without harming your health. Instead of direct consumption on an empty stomach, you can add garlic as a spice to cooked dishes, which allows you to reduce its aggressive effect on the stomach while maintaining its benefits. Thus, taking garlic water on an empty stomach in large doses can lead to serious diseases, such as ulcers and gastritis, due to the irritating effect of allicin on the mucous membrane of the stomach. Moderate use of garlic and refusal to take it on an empty stomach will help to avoid these risks and preserve the health of the gastrointestinal tract. Mistake 2. Excessive consumption of garlic water when you have low blood pressure. This mistake can become a serious health hazard, increasing the risk of dangerous conditions such as hypotension, collapse, and unconsciousness. Garlic is known for its many health benefits, including its ability to lower blood pressure. This effect is due to its composition, which is rich in compounds such as allicin, which have a vasodilating effect and help lower blood pressure. In normal doses, it can be beneficial, especially for people suffering from hypertension. However, excessive consumption of garlic water, especially in people with already low blood pressure, can lead to dangerous consequences. Studies show that high doses of garlic can significantly lower blood pressure. A study published in the journal Phytomedicine noted that regular garlic consumption resulted in an average 10 millimeters of mercury column reduction in systolic blood pressure in patients with hypertension. However, for people with normal or low blood pressure, this reduction can be excessive and cause serious problems. For example, a case of a 48-year-old man at a medical center in New York City was reported who decided to step up his cardiovascular disease prevention and started drinking garlic water in large quantities daily. He did not take into account that his normal blood pressure was below average. After a few weeks, the man began experiencing bouts of dizziness, weakness, and passed out while walking. At the hospital, he was diagnosed with severe hypotension caused by excessive garlic consumption, leading to collapse and the need for emergency medical intervention. To prevent such cases, it is important to control the dosage of garlic and take into account the individual characteristics of the body, especially if the person already suffers from low blood pressure. The optimal solution is to consult a doctor before starting to take garlic water, especially in high doses. If, however, you decide to include garlic water in your diet, start with minimal doses and carefully monitor your body's reaction. It is also important to measure your blood pressure regularly to avoid a dangerous drop. In addition, there are many other foods that can be used to lower blood pressure without having such a powerful effect on the body. For example, pomegranate juice, beets, or fish oil also help normalize blood pressure, but act more gently. Thus, excessive consumption of garlic water for low blood pressure can lead to serious health conditions such as hypotension and collapse due to excessive lowering of blood pressure. Using caution and controlling the dosage will help you avoid these risks and keep you healthy. Mistake 3. Using garlic water by people with impaired blood clotting or those taking anticoagulants. This mistake can be deadly, increasing your risk of developing serious conditions such as internal bleeding, hemorrhagic stroke, and serious clotting disorders. Garlic, due to its anticoagulant properties, has the ability to thin the blood, which can be helpful in preventing thrombosis and reducing the risk of cardiovascular disease. However, in people with impaired blood clotting or those already taking anticoagulants, this exposure can be disastrous. Research shows that garlic contains compounds such as adenosine and allicin that inhibit platelet aggregation, reducing the blood's ability to clot. A scientific article published in the journal Thrombosis Research found that patients taking anticoagulants along with garlic extract had a significant increase in clotting time, significantly increasing the risk of bleeding. For example, the Mayo Clinic in Rochester documented the case of a 62-year-old man who was taking warfarin, a powerful anticoagulant, to prevent thrombosis after suffering a heart attack. On the advice of a friend, he started drinking garlic water daily, believing it would improve his condition. A few weeks later, the man felt a sharp weakness and dizziness, and then lost consciousness. At the hospital, doctors discovered massive internal bleeding caused by the combined effects of warfarin and garlic, resulting in a life-threatening condition. The patient was saved only through an emergency blood transfusion and withdrawal of garlic intake. To prevent such tragic cases, it is extremely important for people with impaired blood clotting or those taking anticoagulants to avoid consuming garlic water or any foods containing large amounts of garlic without consulting a doctor. Your doctor may suggest alternative methods that will not pose such a high health risk. If you do decide to use garlic in your diet, it is important to control the dosage and get regular checkups to monitor your blood clotting status. For example, you can reduce the amount of garlic you consume to a safe minimum or switch to other herbal remedies that do not have such a strong effect on blood clotting. Thus, the use of garlic water by people with impaired blood clotting or those taking anticoagulants can lead to serious conditions such as internal bleeding and hemorrhagic stroke due to the enhanced anticoagulant effect of garlic. Consultation with a doctor and careful adherence to the recommendations will help to avoid these dangerous consequences and preserve your health. Mistake 4. Regular consumption of garlic water in case of kidney disease. This mistake can be deadly, increasing the risk of developing serious conditions such as kidney failure and kidney failure. Garlic, despite its many health benefits, can prove toxic to the kidneys, especially when consumed in large quantities over a long period of time. The kidneys play a key role in filtering and eliminating toxins from the body, and damage to them can lead to serious consequences, including kidney failure. Garlic contains substances such as sulfoxides and disulfides, which can increase the burden on the kidneys, especially when consumed long-term and regularly. In a study published in the Journal of Renal Nutrition, it was noted that patients with chronic kidney disease who regularly consumed garlic in high doses experienced a deterioration in kidney function, leading to the development of kidney failure. A case of a 60-year-old patient suffering from chronic glomerulonephritis was reported at a medical center in California. The patient, convinced of the benefits of garlic for general health, began drinking garlic water in large quantities daily. A few months later, his condition deteriorated dramatically. Acute renal failure developed, requiring emergency hospitalization and hemodialysis. Doctors concluded that the toxic effects of garlic aggravated the already weakened kidney function, which led to a critical condition. To avoid such tragic consequences, people with kidney disease need to take extra care when consuming garlic and garlic water. It is important to consult a doctor before taking any products that may have an effect on the kidneys. If a doctor authorizes garlic consumption, it is important to strictly follow the recommended dosage and avoid consuming large amounts of garlic daily. It is also a good idea to consider alternative ways of boosting immunity and maintaining health that are less aggressive to the kidneys. For example, consuming antioxidant-rich foods such as berries, kale, and green tea can help maintain health without jeopardizing the kidneys. Thus, regular consumption of garlic water for kidney disease can lead to serious conditions such as kidney failure due to the toxic effects of garlic on the weakened organs. Consultation with your doctor, moderation, and prudence will help you avoid these risks and keep your kidneys healthy. Mistake 5. Using garlic water for liver disease. This mistake can become extremely dangerous, increasing your risk of developing serious conditions such as toxic hepatitis and liver failure. Garlic is known to have many health benefits, including antioxidant and anti-inflammatory properties. However, in liver disease, its excessive consumption can lead to serious complications. The liver plays a central role in metabolism and detoxification, so any additional toxic exposure can be fatal for people with pre-existing liver disease. Garlic contains sulfur-containing compounds such as diallyl disulfide, which under normal conditions promote health, but in excess can have hepatotoxic effects. A study published in the Journal of Food Science notes that high doses of garlic can cause oxidative stress in the liver, leading to liver cell damage and inflammation. This is especially dangerous for people with liver diseases such as cirrhosis or hepatitis, as their liver is already weakened and unable to effectively cope with the additional load. The case of a 54-year-old man from Texas suffering from chronic hepatitis C is a well-known case in medical practice. The patient, inspired by stories about the benefits of garlic for the immune system, began to consume garlic water in large quantities every day, believing that it would help him fight the virus. A few weeks later, his condition deteriorated dramatically, with severe abdominal pain, jaundice, and general weakness. Examination revealed that the patient had developed acute toxic hepatitis caused by excessive consumption of garlic, which led to a significant deterioration in liver function. Treatment was long and complicated, but the patient was able to recover only after completely giving up garlic and switching to strict medical treatment. For people with liver disease, it is especially important to avoid excessive consumption of garlic and garlic water. In such cases, it is necessary to strictly follow the doctor's recommendations and in no case resort to self-medication. Your doctor may recommend other natural remedies to support liver health, such as milk thistle, which has a proven hepatoprotective effect. In addition, it is important to remember to have regular medical checkups and liver function monitoring, especially if foods with potential hepatotoxic effects are included in the diet. Thus, the use of garlic water for liver disease can lead to serious consequences, such as toxic hepatitis and liver failure, due to the increased strain on this vital organ. Using caution, consulting your doctor and avoiding self-medication will help you avoid these risks and keep your liver healthy. Mistake 6. Taking garlic water for gastric or duodenal ulcers. This mistake can lead to extremely serious and life-threatening conditions such as ulcer perforation, peritonitis, and sepsis. Peptic ulcer disease of the stomach and duodenum is characterized by the presence of deep defects in the mucous membrane of these organs. In such a situation, any aggressive food or drink can aggravate the condition, potentially leading to fatal consequences. Garlic, known for its powerful antibacterial properties, also has a strong irritating effect, especially on the damaged mucous membranes. Studies show that garlic, despite its beneficial properties, can significantly increase the acidity of gastric juice and cause increased inflammation in the gastric and duodenal mucosa. One study published in the World Journal of Gastroenterology found that regular use of garlic can cause an exacerbation of peptic ulcer disease in 20% of patients, especially when taken on an empty stomach. In the practice of a gastroenterologist in Boston, there was a case of a 58-year-old patient who suffered from chronic peptic ulcer disease. She, in an effort to improve her general health, began daily consumption of garlic water on the advice of acquaintances. A few weeks later, the woman felt a sharp deterioration in her health. There was severe abdominal pain, nausea, and soon there was an acute condition requiring urgent hospitalization. Upon examination, the doctors diagnosed perforation of the stomach ulcer, which led to peritonitis, inflammation of the peritoneum. The patient required emergency surgery and prolonged treatment to regain her health. People suffering from peptic ulcer disease of the stomach or duodenum are strongly discouraged from consuming garlic water, especially on an empty stomach. Instead, you should focus on a diet that protects the mucous membranes and promotes ulcer healing. It is important to avoid foods that can increase stomach acidity or irritate the mucous membranes, including garlic. The best solution is to follow your doctor's recommendations and use medications that promote ulcer healing and protect the gastric mucosa. For example, you can use antacids, proton pump inhibitors, or other medications prescribed by your doctor. Thus, taking garlic water for gastric or duodenal ulcers can lead to serious conditions such as ulcer perforation, peritonitis, and sepsis due to the strong irritating effect of garlic on the damaged mucous membrane. Following the doctor's recommendations and avoiding aggressive products will help avoid these dangerous conditions and preserve the health of the gastrointestinal tract. Mistake 7. Regular consumption of garlic water during pregnancy. This mistake can become extremely dangerous for the health of the mother and child, increasing the risk of severe conditions such as premature labor, miscarriage, and toxemia. Pregnancy is a special period when even familiar foods can have unexpected effects on the body. Garlic, which has strong stimulating and antibacterial properties, can affect the tone of the uterus and a woman's hormonal balance. Garlic can be beneficial in small quantities, but if consumed regularly and excessively, it can cause serious complications, up to and including termination of pregnancy. Studies show that garlic's active ingredients, such as allicin and diallyl disulfide, can stimulate uterine contractions. In an animal experiment published in the journal Reproductive Toxicology, high doses of garlic extract were found to increase the risk of miscarriage and preterm labor by affecting the smooth muscles of the uterus. Such effects in humans can lead to serious consequences, especially in early pregnancy, when any stimulation of the uterus can be critical. One example, recorded at a medical center in New York City, involved a 32-year-old woman who, in an effort to boost her immune system during pregnancy, began drinking garlic water daily. She believed it would help prevent colds and other illnesses. However, a few weeks later, the woman developed lower abdominal pain and signs of premature labor in her 28th week of pregnancy. Doctors were able to stabilize her condition, but it was clear that regular garlic consumption had affected the tone of the uterus, triggering the threat of premature labor. During pregnancy, it is crucial to carefully monitor your diet and avoid foods that may pose a risk to the mother and baby. Doctors recommend that pregnant women limit their consumption of garlic and garlic water, especially if there have been previous cases of threatened abortion or preterm labor. Instead of garlic, you can use safer natural remedies to support the immune system, such as vitamin C from fruits or light herbal teas that do not affect the uterus. It is also a good idea to discuss any dietary changes with your doctor, who will be able to give professional advice and ensure the safety of mother and baby. In summary, regular consumption of garlic water during pregnancy can lead to serious consequences such as premature labor, miscarriage, and toxicosis due to garlic's ability to stimulate uterine contractions. Being careful in your food choices and consulting your doctor can help you avoid these risks and ensure a healthy pregnancy. Mistake 8. Using garlic water by people with cardiovascular disease without consulting a doctor. This mistake can become extremely dangerous, increasing the risk of developing serious conditions such as myocardial infarction, arrhythmias, and heart failure. Garlic is widely known for its cardiovascular benefits, including lowering cholesterol and blood pressure. However, its consumption may not be as safe for people with pre-existing cardiovascular disease, especially if garlic water intake is taken without first consulting a doctor. The effects of garlic on the cardiovascular system are multifaceted and in certain conditions can lead to dangerous complications. Studies show that garlic may interact with certain medications prescribed for cardiovascular disease, such as beta blockers, angiotensin-converting enzyme inhibitors, and anticoagulants. A study published in the Journal of the American College of Cardiology found that patients who took garlic supplements concurrently with hypertension medications experienced cases of serious arrhythmias and even sudden cardiac arrest. A case of a 65-year-old patient suffering from chronic heart failure and taking prescribed medications was reported in a Chicago hospital. The patient decided to improve his condition on his own and started drinking garlic water daily without notifying his doctor. After some time, he felt a sharp deterioration in his health, with severe chest pain and shortness of breath. In the hospital, he was diagnosed with worsening heart failure and arrhythmia caused by the combination of garlic and the medicines he was taking. Doctors had to administer emergency therapy to stabilize the patient's condition. For people with cardiovascular diseases, it is extremely important not to resort to self-medication and not to introduce new products, such as garlic water, into the diet without consulting a doctor. A specialist can determine if garlic consumption is acceptable in a particular case and, if necessary, adjust the dosage of medications to avoid dangerous interactions. In addition, there are many other methods of improving cardiovascular health that can be safely integrated into physician-supervised treatment. For example, moderate exercise, a balanced diet, and avoidance of unhealthy habits can have a positive impact on the heart without the risk of negative consequences. Thus, the use of garlic water by people with cardiovascular disease without the advice of a physician can lead to serious conditions such as myocardial infarction, arrhythmias, and heart failure due to the possible interaction of garlic with the medications taken. An informed approach to treatment and working closely with your doctor can help you avoid these risks and keep your heart healthy. Mistake 9. Consuming garlic water for gastroesophageal reflux disease, GERD. This mistake can lead to significant health problems by contributing to worsening symptoms of gastroesophageal reflux disease, GERD, developing esophagitis, and increasing the risk of esophageal cancer. Gastroesophageal reflux disease is a chronic condition in which acid from the stomach is forced into the esophagus, causing inflammation of its mucous membrane and painful symptoms such as heartburn, burning, and pain behind the sternum. Garlic, with its ability to increase gastric juice secretion, can significantly worsen the condition of patients with GERD. Studies show that eating garlic can increase the acidity of gastric juice and increase the likelihood of reflux. A study published in the American Journal of Gastroenterology found that 25% of GERD patients who consumed garlic on a regular basis experienced an increase in symptoms and worsening of the condition, including the development of esophagitis, an inflammation of the mucous membrane of the esophagus. A case study from a medical practice in New York describes the case of a 50-year-old man who suffered from chronic GERD. The man, trying to cope with a cold, began drinking garlic water daily, believing it to be a natural and safe treatment method. However, he soon noticed a significant increase in heartburn and sternal pain, especially at night. It turned out that his garlic water habit not only aggravated his symptoms, but also led to the development of erosions in his esophagus. Doctors diagnosed him with acute esophagitis, and it took long-term treatment to repair the damaged mucosa. People with GERD need to be especially cautious of foods that can increase stomach acidity and cause reflux. Consumption of garlic water in this disease is strongly discouraged. Instead, you should focus on foods and drinks that help reduce acidity and minimize the risk of reflux, such as oatmeal, bananas, ginger, and herbal teas. It is also important to follow general dietary guidelines for GERD. Avoid overeating, don't lie down after eating, and eliminate spicy, fatty, and acidic foods that can exacerbate symptoms. Thus, drinking garlic water for gastroesophageal reflux disease can lead to serious complications such as worsening symptoms, development of esophagitis, and even esophageal cancer due to garlic's ability to increase stomach acidity. Choosing the right foods and following your doctor's recommendations can help you avoid these risks and keep your digestive system healthy. Mistake 10. Self-treatment with garlic water for infectious diseases. This mistake can cause serious complications such as worsening of the infection, development of sepsis, and multi-organ failure. Garlic is widely known for its antibacterial and antiviral properties, making it a popular folk medicine remedy for treating various infectious diseases. However, using garlic water as the sole method of treating infections, especially without consulting a doctor, can lead to dangerous consequences. While garlic can temporarily relieve symptoms, it is not always effective in dealing with the underlying infectious agent. Despite the powerful antibacterial properties of garlic, its effects are not always enough to completely eliminate pathogens. A study published in the Journal of Antimicrobial Chemotherapy noted that while garlic can inhibit the growth of some bacteria, it cannot replace traditional antibiotics in the treatment of serious infections. It is important to realize that symptoms may temporarily disappear, but the infection continues to grow, which can lead to severe complications. An example from a medical practice in Boston shows just how dangerous it is to self-medicate with garlic water for infectious diseases. A 47-year-old man suffering from chronic sinusitis decided to forego antibiotics and treat the disease himself with garlic water. At first, the symptoms did subside and the patient felt better. However, a few weeks later, he was hospitalized with high fever, chest pain, and shortness of breath. It turned out that the infection had spread to his lungs and caused severe pneumonia. As a result of untimely treatment, sepsis developed, requiring intensive care and a long recovery. It is important to seek immediate medical attention for any infectious disease. Garlic water can be used as an adjunct to mainstream therapy, but should never replace doctor-prescribed antibiotics or other medications. The doctor can determine the nature of the infection and prescribe the appropriate treatment that will effectively deal with the causative agent and prevent the development of complications. In addition, garlic can be used as part of a healthy and balanced diet to support the immune system and increase the body's resistance to infection, but not as a primary treatment. Thus, Self-treatment with garlic water for infectious diseases can lead to serious complications such as sepsis and multi-organ failure, as garlic is not always able to eliminate the infectious agent. Contacting a doctor and strictly following the prescribed treatment will help avoid these risks and ensure a successful recovery. Mistake 11. Taking garlic water in large doses for diabetes. This mistake can lead to serious health consequences such as hypoglycemia and even hypoglycemic coma. Diabetes is a chronic disease in which the body is unable to regulate blood sugar levels properly. People with diabetes have to carefully monitor their diet and control their glucose levels to avoid drastic fluctuations. Garlic is known for its property of lowering blood sugar levels, which can be beneficial in moderate amounts. However, taking garlic water in large doses can lead to dangerous consequences for diabetics. Several studies have found that garlic can enhance the effects of insulin and lower blood sugar levels. One study published in the Journal of Medicinal Food noted that regular consumption of garlic helps lower blood glucose levels in patients with type 2 diabetes. However, when garlic is overused in combination with sugar-lowering medications, it can lead to hypoglycemia, a condition in which sugar levels drop below normal, which is life-threatening. A medical case study in California illustrates the potential dangers. A 60-year-old man with type 2 diabetes decided to improve his condition by taking garlic water 3 times a day, in addition to his regular dose of insulin. After a few days, he began to feel weakness, dizziness, and confusion in his thoughts. He had difficulty concentrating and eventually lost consciousness. At the hospital, he was diagnosed with a hypoglycemic coma caused by a sudden drop in blood sugar levels. Doctors were able to stabilize his condition, but this incident showed how dangerous the combination of garlic and medication can be without proper monitoring. For people with diabetes, it is important to strictly follow your doctor's recommendations and monitor your blood sugar levels, especially when adding foods to your diet that can affect glucose levels. If you decide to use garlic water, it is important to do so in moderation and under the supervision of your doctor. Your dose of insulin or other sugar-lowering medications may need to be adjusted to avoid hypoglycemia. It is also important to monitor your sugar levels regularly with a glucometer, especially if you introduce new foods into your diet or increase their dosage. Thus, taking garlic water in high doses in diabetes can lead to dangerous conditions such as hypoglycemia and hypoglycemic coma due to the severe drop in blood sugar levels. Following moderation, monitoring glucose levels, and consulting your doctor can help you avoid these risks and keep you healthy. Mistake 12. Consuming garlic water if you have a garlic allergy. This mistake can lead to extremely life-threatening conditions such as anaphylactic shock and Quincke's edema. Garlic allergies are relatively rare, but they can be very severe. For people who have an allergic reaction to garlic, drinking garlic water can cause dangerous consequences, up to and including anaphylactic shock, a condition that requires immediate medical attention. Research shows that garlic allergies, while not widespread, can manifest in a variety of ways, from mild itching to serious systemic reactions. A study published in the Journal of Allergy and Clinical Immunology noted that even small amounts of garlic can cause severe allergic reactions in sensitive individuals. Anaphylactic shock, as an extreme manifestation of allergy, requires urgent medical attention, as it can be life-threatening within minutes. An example from an allergist in New York City shows how dangerous garlic consumption can be for people with allergies. A 35-year-old woman suffering from seasonal allergies decided to improve her health with garlic water. Already after the first intake, she experienced severe swelling of her lips and tongue, difficulty breathing, and a drop in blood pressure. She was immediately taken to the hospital, where doctors diagnosed anaphylactic shock caused by an allergic reaction to garlic. The patient was given emergency treatment, which stabilized her condition, but this case became a serious warning for allergy sufferers to be careful with garlic. For people with a confirmed garlic allergy, it is important to completely eliminate garlic from the diet, including any form of garlic such as garlic water, powder, or supplements. At the first sign of an allergic reaction, such as itching, swelling, or difficulty breathing, medical attention should be sought immediately. A doctor may prescribe antihistamines, or if there is a risk of anaphylaxis, recommend carrying adrenaline in an auto-injector that can be used at the first signs of shock. In addition, it is important to alert doctors and loved ones to garlic allergies to avoid accidental consumption. Thus, drinking garlic water if you have a garlic allergy can lead to severe allergic reactions such as anaphylactic shock and Quincke's edema, which is directly life-threatening. Completely eliminating garlic from your diet and following precautions will help avoid these dangerous conditions and keep you healthy. Mistake 13. Using garlic water by people with irritable bowel syndrome, IBS. This mistake can lead to serious complications, including an exacerbation of irritable bowel syndrome, IBS, and the development of chronic colitis. Irritable bowel syndrome is a common functional disorder characterized by abdominal pain, bloating, diarrhea, and/or constipation. People with this condition often experience intestinal hypersensitivity and motility disorders. Garlic, which has a strong irritant effect, especially in the form of garlic water, can exacerbate IBS symptoms and cause an exacerbation of the condition. Studies show that garlic can stimulate the gastrointestinal tract and increase gastric juice secretion, which can irritate the intestinal mucosa. The study, published in the Journal of Gastroenterology and Hepatology, noted that 30% of IBS patients who included garlic in their diet experienced a significant increase in symptoms such as abdominal pain and diarrhea. This is because garlic can cause increased peristalsis and irritation of the intestinal mucosa, which is especially dangerous for people with pre-existing digestive conditions. An example from a medical practice in San Francisco demonstrates just how serious the consequences of drinking garlic water for IBS can be. A 40-year-old woman suffering from IBS decided to try folk remedies to improve her digestion and began drinking garlic water daily. Within a week, she experienced a sharp deterioration of her condition. Severe abdominal pain, bloating, and frequent diarrhea appeared. The patient was forced to seek medical help, where she was diagnosed with an exacerbation of IBS and chronic colitis, caused by the irritating effect of garlic on the intestines. Doctors prescribed her a strict diet and the elimination of all foods that can irritate the intestines, including garlic. For people with irritable bowel syndrome, it is important to avoid foods that can irritate the intestines and worsen symptoms. Garlic, especially in a concentrated form such as garlic water, should be eliminated from the diet. Instead, it is recommended to focus on foods that help normalize bowel function, such as oatmeal, bananas, rice, and cooked vegetables, which are easily digested and do not cause irritation. In addition, regular follow-up with a gastroenterologist and adherence to dietary recommendations will help control the symptoms of IBS and prevent exacerbations. Thus, the use of garlic water by people with irritable bowel syndrome can lead to exacerbation of symptoms such as abdominal pain and diarrhea, as well as the development of chronic colitis due to the irritating effects of garlic on the intestines. Avoiding irritating foods and following your doctor's recommendations can help keep you healthy and control your IBS symptoms. Mistake 14. Long-term use of garlic water without taking breaks. This mistake can lead to serious health consequences, including toxic organ damage and chronic poisoning. Garlic, despite its many health benefits, contains active compounds, such as sulfur-containing components and allicin, which can accumulate in the body, causing toxic effects if consumed over a long period of time and excessively. Continuous use of garlic water without rest periods can cause gradual damage to internal organs, such as the liver and kidneys, as well as disrupt the gastrointestinal tract. Studies show that long-term consumption of high doses of garlic can negatively affect organ function. In a study published in Toxicology Letters, it was found that regular consumption of garlic in high concentrations leads to changes in liver enzyme activity, which can cause liver damage. There is also a risk of impairment of the kidneys and other organs that are involved in detoxification of the body. A case study from a medical practice in Los Angeles describes the case of a 55-year-old man who had been drinking large quantities of garlic water daily for several months, believing it would improve his overall health and strengthen his immune system. At first, he felt alert and energetic, but over time, he began to notice constant fatigue, abdominal pain, and decreased appetite. When he went to the doctor, he learned that he had developed toxic liver and kidney damage due to prolonged and excessive use of garlic. The man was forced to undergo a course of intensive therapy and significantly change his diet to restore his health. To avoid such consequences, it is important to observe moderation and take breaks when drinking garlic water. It is advisable to use garlic in your diet in reasonable amounts and not to exceed the recommended doses. If you use garlic water for therapeutic purposes, be sure to consult your doctor about the length of the course and the need for breaks. It is also a good idea to include a variety of foods in your diet that support health and provide essential nutrients without the risk of toxic exposure. Regular medical checkups and health monitoring will help to detect and prevent possible complications in time. Thus, long-term use of garlic water without interruption can lead to toxic organ damage and chronic poisoning due to the accumulation of active garlic compounds in the body. Following moderation, taking breaks and regular consultations with your doctor can help you avoid these risks and maintain good health. Mistake 15. Using garlic water as the only treatment for serious illnesses. This mistake can cause disease progression and can be fatal. Garlic is certainly a powerful natural remedy with antibacterial, antiviral, and anti-inflammatory properties. However, relying solely on garlic water as the only treatment for serious conditions such as cancer, cardiovascular disease, or infections can be extremely dangerous. Foregoing professional medical care in favor of folk remedies can lead to disease progression and ultimately death. Research shows that while garlic can help boost immunity and support the body, its effectiveness in treating serious illnesses is limited and cannot replace traditional medical therapy. An article published in the Journal of Clinical Oncology highlighted that patients who delay or forego standard cancer treatment in favor of alternative methods, such as garlic consumption, have a significantly higher risk of mortality. An example from a medical practice in Chicago illustrates the dangers of this approach. A 52-year-old man diagnosed with colorectal cancer refused chemotherapy and decided to be treated exclusively with garlic water, believing that the natural remedy could beat the disease. For months, his condition worsened, but he continued to hope for a miraculous cure. When he finally went to the doctors, the disease had already reached an incurable stage. The doctors were forced to state that delaying treatment had significantly reduced his chances of survival. To treat serious illnesses, it is important to follow the advice of professional doctors and use proven treatments that have been proven effective in clinical trials. Garlic water can be part of a comprehensive health promotion program, but it should not replace medical therapy. If you are considering using garlic as an adjunct to your primary treatment, be sure to discuss it with your doctor to avoid potential interactions and adverse effects. It is also important to realize that timely diagnosis and proper treatment are key to success in the fight against serious illnesses. Folk remedies can help support general health, but may not be the mainstay of treatment for life-threatening conditions. Thus, using garlic water as the only treatment for serious illnesses can lead to disease progression and death because there is a lack of adequate medical care. A combined approach involving qualified professionals and utilizing proven treatments is the best way to fight dangerous diseases and stay healthy. These mistakes when using garlic water emphasize the importance of a sensible approach to its use and the need to consult a physician, especially in the presence of chronic conditions. How to use garlic water safely for maximum benefits. Garlic water, with its many healing properties, can be a true elixir of health if used correctly. However, to maximize the benefits and avoid possible risks, it is important to follow a few simple but very important rules. First of all, for the preparation of garlic water, choose only fresh and high-quality garlic heads. Old or damaged garlic can contain substances that not only reduce its beneficial properties, but can also cause undesirable effects. It is best to use organic garlic grown without the use of chemical fertilizers and pesticides. To prepare garlic water, it is enough to take 1 medium head of garlic, peel it, and finely chop or crush the cloves. After that, you need to pour the garlic with 1 liter of warm water, the temperature of which does not exceed 40 degrees Celsius, 104 degrees Fahrenheit. It is important to note that boiling water destroys the active components of garlic, so you should avoid using too hot water. The resulting mixture should be infused for 8 to 10 hours. It is best to leave it overnight. Consumption of garlic water also requires prudence. To begin with, it is recommended to drink no more than 50 to 100 milliliters of the infusion in the morning on an empty stomach. This will help to activate the metabolism and start the processes of cleansing the body. However, it is important to remember that if you have not previously consumed garlic in such quantities, it is worth starting with smaller doses, gradually increasing the amount so that the body gets used to the new product. You can take 1 or 2 more 50 milliliter servings during the day, but do not exceed the total daily dose of 200 milliliters. Garlic water can have powerful effects on the body, so it is important to use in moderation to avoid irritation of the gastric mucosa or other side effects. For best results, it is recommended to consume garlic water in courses, alternating them with breaks. For example, you can drink garlic water for a week, then take a break for 10 to 14 days. This will allow the body to get all the useful substances, while avoiding the risk of accumulation of active components of garlic, which can cause undesirable consequences with excessive use. It is important to remember that garlic water can interact with some medications, especially those that thin the blood or regulate sugar levels. Therefore, if you are taking medications, be sure to consult your doctor before starting a course of garlic water. Thus, proper and conscious use of garlic water can become a healthy habit that will improve your health and give you energy and vitality. By following simple rules of preparation and dosage, you can maximize the benefits of this natural remedy without risking your health. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.